Hello and welcome to this introductory presentation about MO1016 Focused Assessment with Sonography and Trauma. This module supports your development of fundamental knowledge and skills in EFAST scanning principles and techniques. While the module does not assess proficiency or competency in sonography or EFAST scanning, you'll engage with both theory and structured observation sessions before applying your learning in a clinical context via a series of supervised practice sessions. The supervised sessions will be conducted with a consenting client or volunteer, providing you with valuable opportunity to gain practical insight into what competencies are required to perform the work of an accredited practitioner. You'll also create an EFAST scanning procedure designed to optimise care in your local, rural and/or remote setting in accordance with best practice guidelines and local service strategic intent. The intended learning outcome for this module is that you'll be able to combine developing fundamental knowledge and skill in EFAST scanning with advanced self-reflection skills to perform and critique the adequacy of an EFAST examination and resultant images, and construct an EFAST scanning procedure designed to optimise care in the rural and/or remote setting in accordance with best practice guidelines and local service strategic intent. The module goes for 6 weeks. Unlike other modules, this module is worth 1 credit point rather than half a credit point. This is reflected in the expected workload of 44 hours. You can see the weekly topics here. In week 1, Introduction to EFAST Scanning and Technical Parameters, you'll gain an understanding about the professional responsibilities for ultrasound imaging scope and an overview of EFAST scanning. You'll plan your ultrasonography observation and supervised practice sessions before identifying and developing an understanding of technical ultrasound image production parameters. Lastly, you'll explore ultrasound imaging planes, corresponding image orientations, and recommended transducer approaches. In week 2, Anatomy and Image Correlation, you'll identify relevant structural anatomy in regions of interest covered by EFAST scanning, learn about ultrasound terminology and appearances of relevant structural anatomy, and identify common ultrasound pathologies and pitfalls in EFAST scanning. This week concludes with you testing your knowledge and discussing your test results with your work-based supervisor. In week 3, sonographic observation, you'll implement your observation sessions and critically reflect upon them before discussing with your work-based supervisor. In week 4, supervised practice, you'll implement your supervised practice sessions and critically reflect upon them before discussing with your work-based supervisor. In week 5, the process and practicality of EFAST scanning, you'll consolidate your knowledge of EFAST scanning before developing an EFAST scanning procedure for your local context. The week concludes with considering EFAST scanning in the rural and/or remote context. In week 6, critical reflection, you'll meet with your work-based supervisor to discuss the EFAST scan you'll be submitting for assessment item 1 before critically reflecting upon what you have learnt about EFAST scanning. You'll then finalise and submit assessment item 1. A single assessment task is due at the end of the module in week 6. The task is a portfolio containing a video recording of you conducting an EFAST scan on your chosen volunteer, a critical reflection of your EFAST scan, a selection of representative images from your EFAST scan, the EFAST scanning procedure you develop, and completed supervised practice log. You will also have the opportunity to submit a formative piece of work at the end of week 2. This is your module workbook, which is not marked but will give you some feedback on how you are going. We've built in some opportunities for you to interact with the content, the module coordinator, and other participants who are taking the module at the same time. There are learning activities which include contributing to online discussions. This provides a chance and an expectation for you to swap professional insights with others who may be from the same or other health professions. This mutual exchange of knowledge is the basis of successful collaborative team practice, so we hope you'll join in. You'll find the module outline in the Start Here folder. It contains your module coordinator's contact information, all the details of the assessment task and masking criteria, information about applying for extensions, any module prerequisites, and the module calendar. Please don't hesitate to get in touch for any questions or concerns, and enjoy the module.